touch on the V-line disruptions that have occurred this morning. I also want to say a little bit about our road toll. And I'm pleased to be here with Jerome Weimer, Nick Fower, Head of Transport Services, the Department of Transport, and Joe Calafiore as well from the Transport Accident Commission. There were 334 cases yesterday. All were locally acquired. 149 of today's cases are linked to known outbreaks. The rest are under investigation. Sadly, we have been notified of one death, a man in his 70s, and our thoughts go out to that gentleman's family, friends, and everyone that were touched by his life. This is tragic news, and we know we need to be vigilant going forward. We now have 2,426 active cases, all except 5 are locally acquired. 347 are aged 0 to 9, 386 are aged 10 to 19, 606 are aged in their 20s, 418 are aged in their 30s. 85% of all active cases are under the age of 50. 127 people are in hospital. That's an increase of 16 from yesterday. 33 are in ICU and 21 are sadly also on a ventilator. Vaccines. 39,027 vaccines were administered yesterday. This is the third day in a row we have posted a record rate of vaccinations in state-run vaccination sites. 42,998 tests were processed, and we have clocked over 10 million tests undertaken since January 1, 2020. And that's a tremendous effort for all Victorians that have come forward and got vaccinated. Well done. Of the cases who were in hospital yesterday, 90% were not vaccinated. 10% had had one dose. None in hospital had been fully vaccinated. Lastly, a big reminder to all Victorians, if you do have any symptoms, please go and get tested. If you can also, please book a vaccination appointment if you haven't already. Can I also touch on the disruptions that have occurred this morning to the V-line network? And as Public Transport Minister, can I please express my gratitude to all the commuters out there that we know, particularly frontline workers, that rely on our public transport system. We are in the service business, and that's what we try to do every day. But sadly, a gentleman has tested positive that was a V-line trainer driver. He had been confirmed to have been in the staff room at Southern Cross Station and had travelled as part of his duties, wearing a mask, being compliant, doing all the right things, did travel to Gippsland. That gentleman has tested positive, and now everyone that had been in that staff room, which is also a room that staff go and check their rosters, have now all been contacted and been told to do the right thing and isolate and to get tested if you have had symptoms. This has had an impact on our V-line driver network, as you can imagine. As I speak, some 20 services are now being disrupted, and we have 5 coaches out on the network supporting passengers where they need to go. While we only have 20 services at the moment, all the staff rostered on at V-line are safe and have come to work as per their roster and had no contact with this gentleman, all being at Southern Cross Station. We are expecting the disruptions to go from 20 to around 100 services today. I've met with and spoken over the phone with the staff at V-line, management, the CEO, and we're working very hard throughout today to do everything we can to minimise disruptions, particularly as many Victorians get back to their working week, particularly in regional Victoria on Monday. So we are doing everything we can to minimise those disruptions. I also just want to say a little bit about, as Road Safety Minister and Roads Minister, about the road toll. Sadly, 156 Victorians have already lost their lives this year. That is up at this stage, that is more than the 148 at the same time last year. And let's make no mistake, each one of those 156 deaths was preventable. We all have a role to play in making sure we travel safely, mindfully on the roads. And our government, the Andrews government, has committed to halving road trauma by 2030 and having 0 deaths on our roads by 2050. We're also making sure through our road safety strategy that we have a real emphasis on vulnerable Victorians. We've made important reform that's also been embedded with coming out of the pandemic, whether it's people on motorcycles, whether it's people involved in the gig economy, whether it's cyclists, that we need to do more, and we are doing more. But I will ask later Joe to also speak to this. The TAC, as they do regularly, and it's also supported by Victoria Police and our infringement data, have a comprehensive study that they are releasing that does show that the majority of Victorians that think they're good drivers, some 2/3 of those drivers think it's okay and safe to do so to travel up to 10 kilometres over the limit. Travelling up to 10 kilometres over the limit doubles the likelihood of you being in an accident and, even worse, losing your life. So our message is very clear, particularly coming out of the COVID pandemic, where we have seen a flight back to motor vehicles and less people using the public transport system. Be mindful on the roads, take your time. Realise too, it may take a little bit longer to where you need to go, but get there safely and get there in a safe manner, and be sure that you do follow the rules. That's all I have to say at the moment. We'll come back for questions. I will now ask Jerome Weimer to please give an update, followed by Joe Calafiore from the TAC, and we also have Nick Fower here from the Department of Transport, Head of Transport Services, to take any questions as well. So thank you.
Thank you, Minister, and good morning. 334 positive cases of COVID today in Victoria. There is sadly, of course, one death, and we extend our condolences and thoughts to the family of the deceased. It's a man in his 70s from Coburg. 127 Victorians in hospital at the moment with COVID, of whom 33 are in intensive care and 21 are on ventilators. We've also, of course, with close to 43,000 test results yesterday, we've now delivered over 10 million COVID tests in Victoria since the very start of this pandemic, well over 1.5 million of those in the last few weeks as we deal with this current Delta outbreak. I'd just like to thank all those 10 million Victorians, all those people who've come forward and got tested over the long 18 to 20 months that we've been working in this pandemic, and of course the fabulous staff in our testing stations, in our pathology labs, who are working literally around the clock to make sure that all those tests are processed and returned back. 99%, over 99% of all those test results are coming back the next day, giving anybody who's got symptoms the confidence that they'll get a quick answer as to whether they have COVID or not, and whether they present any risk to the people they live with and the people that they may work with. I would urge anybody who is feeling symptoms at any point in time, please make use of that testing facility. We are continuing to expand our testing centres. We've extended the operating hours again of 3 of our busiest sites in the northern and western suburbs to 12 hours, to 8 p.m. at night, to make sure that we can continue to meet the demand for testing that we're seeing out there. I'd also like to point people again to the very large showground site that we have. If people are concerned at all about waiting times at our sites, and some of our sites again yesterday were busy, then please look at options around. We have a real-time update on our website that will tell you where your nearest sites are, and also how long the queues are likely to be. And for those of you in the inner north or inner west, the showground site is a very good option as one that has always good capacity and short waiting times. In this time, of course, there are not many reasons to leave your house, but getting a COVID test is one of them, and you can travel more than 5 kilometres to get your COVID test, of course, within the metropolitan area. And if you're in regional Victoria, please, of course, stay within the regional Vic areas. Finally, with regard to testing, we're now seeing up to 8,000 people a day applying for the test isolation payment. So for anybody who is concerned about losing work, anybody who needs to miss a shift, anybody who's concerned about not getting paid for the time they're going to miss while they're waiting for that 24-hour turnaround on a COVID test, you are eligible for a $450 test isolation payment. 8,000 people a day are now applying and getting that payment. It is easy to do. Details are on our website and will be sent to you if you're getting a test. Please, I'd encourage you to make use of it. It is far more important that we enable you to miss a day's work and to still get paid to ensure that you get tested and that you isolate, so we can contain the positive cases that are out there in our community. With regard to vaccination, another record day of vaccinations in our state clinics. Over 39,000 people came forward yesterday to get their vaccination done. And again, my thanks to everybody who is now making it their priority to get vaccinated. 64% of Victorians have now had their first dose vaccination. That's a really encouraging step. We are ahead of our projection of our first of our 1 million dose surge that we announced a few weeks ago, but also we're starting to really get ahead of that date to get to 70% of Victorians having had their first dose. A bit more work to go, but we think we will be well ahead of that original date of the 23rd of September. We think we'll smash that by quite a few days. I'm also pleased to see that 71,000 people made vaccination bookings yesterday. And so again, please, if you haven't yet booked your first dose, please do so. There are multiple appointments available of both vaccine types across our clinics. There is Pfizer still available. There are AstraZeneca doses still available. We are releasing more doses just about every day. As any opportunities we find for doses that are spare and that are not being utilised, we put them back into the system. So please keep checking. If you haven't got your appointment yet, please check and make that appointment over the days ahead. Right now, we've got 10,000 first dose AstraZeneca appointments available in just the 7 days. And I know our teams are loading more Pfizer appointments into the system yesterday and again today. So please do check to see if you can get your vaccine sorted out in the next few days. Finally, with regard to vaccination, we've seen really strong uptake of our VCE students coming forward to get vaccinated. At least 56,000 of 16, 17 and 18-year-olds have already had their first dose vaccination. That's a really encouraging sign, and we'd encourage anybody in that 16, 17, 18-year-old age group, if you've got a VCE date due and if you're due to take the GAT on the 5th of October, please come forward to get your first dose done. There is a priority booking service available for you. We are still holding first doses for those remaining students who have not yet had their first dose appointment. We'd encourage you, please, to get it done in the next few days so that you can head into your GAT and VCE preparation with confidence. With regard to the outbreak, so 334 new cases in the last 24 hours, and a very familiar now pattern of spread of where those cases are falling. 190 of those cases are in our northern suburbs, including suburbs like Craigieburn and Roxburgh Park. We've also seen 109 cases dropping in our western suburbs, in places such as Truganina and Altona North. We have 9 cases in the eastern suburbs, 16 cases in our southeast suburbs, including Noble Park and Frankston. And I'm a little bit concerned about the number of cases we're starting to see creeping into the southeast. So we have a dedicated focus with our southeast public health team. I'd please encourage anybody, particularly in the Dandenong area in the southeast, please check those exposure site maps on a regular basis, and please be very aware of your symptoms. We're obviously dealing with significant community transmission in the north and west of our city. Huge number of people dedicated around the clock to doing everything we can to run that transmission to ground and to stop it in its tracks. But we are seeing a little bit of seeding out into the south and east, and we're very keen to ensure the community down there is also aware of the risk of COVID in our community. Finally, we have 4 cases in regional LGAs. One of those is the V-Line staff member that the Minister briefly spoke to, who resides in Gippsland, but again, got tested very early. We have a good understanding of their movements, and rapid contact tracing is taking place. My thanks to the entire team at V-Line for supporting us over the coming days as we work to make sure that their workforce has not been exposed. We also have a construction worker in Mitchellshire who works in a wider Metro Melbourne construction site. Again, we understand they're isolating safely. And we have a call centre worker in Kinglake, again a call centre worker who works in the CBD and is part of one of our call centre outbreaks. There was one more case we believe is in Bacchus Marsh. We're just running that one to ground at the moment. We'll release more details this afternoon in the Cho release if they are to be reported. In terms of key sites of interest and key exposure areas, I mentioned yesterday the aged care facilities in Moonee Ponds and at Gladstone Park. I'm pleased to confirm we've had no further positive cases arising out of those facilities and very good testing levels and very good vaccination levels. And again, it highlights the importance of vaccination in stopping the spread of COVID in these most vulnerable and important facilities. And I'm very pleased to see such high vaccination levels amongst both their staff and their residents. We also have continued to see significant case numbers at Kassar Suites, that's K-A-S-R Suites in Coolaroo. We've spoken about the site a number of times in the last week. We now have 57 cases associated with this community store, obviously a significant cluster of concern. And my thanks to both the owners of those stores, of the store, and the associated community for their support in the wider testing program we've been working on with them over the last few days. We also have a significant number of cases at Al-Hajj Meats in Glenroy. Again, we see now 43 cases, an increase of 9 on yesterday. Again, a significant community transmission, and one we spoke to the other day around community retail stores, local community stores being quite a significant cluster in some cases of positive cases. Again, we urge all people, whichever stores you're using, whichever parts of the community you're in, please make sure you're using the QR code check-in, because we are seeing transmission hubs at these locations. And please make sure, of course, you do all the social distancing and mask wearing that we need to do at this quite challenging time. Finally, at the Acquire call centre, we've seen an increase of 10 cases, all in household primary close contacts of cases we've known about. That takes us to 78 for that outbreak at this point in time. Similarly, the Box Hill construction site now has 115 associated cases with it. It's now one of our largest sites that we're working on. Again, a significantly mobile workforce. We are now at day 10 of that outbreak. Day 13 testing, we think, will identify possibly a few more cases. And finally, another CBD construction site with 1 new case, taking us to 9 cases, again across multiple levels of a significant office fit-out. Still working on a number of other cases or a number of other leads in that investigation. Finally, of course, today is a positive step forward for regional Victorians as we see an easing of restriction at midnight last night. I would encourage, please, all regional Victorians, please be aware of the continued threat of COVID in all of our communities at this time. As we're seeing in today's cases, we're fortunately seeing not many cases, 4 cases of people residing in regional Victoria, but with clear links back into Metro Melbourne. Again, any authorised workers, if you're living in regional Victoria but continuing to work in Metro Melbourne as an authorised worker, please be very mindful of all those COVID-safe practices and make sure you get tested immediately if you have any symptoms. I'd also please urge all Melburnians at this time, stay where you are, stay within your 5K radius, stay within Metro Melbourne. This is not a time to be going into regional Victoria. With the level of community transmission we're now seeing, particularly in the north and west of our city, it is our job as Melburnians to stand our ground here and to fight this fight here and to get it down as quickly as we can and to look to better days ahead. With that, I'll hand over to Joel Caraforio from TAC.
Thank you very much, Jerome, and thank you, Minister. At the TAC, we regularly survey Victorians to get their views on a range of matters, and recently we asked 1,500 Victorians their views on all sorts of road safety issues. The vast majority of Victorians know that speeding and taking drugs and drink driving is dangerous. What's really alarming and concerning is that 2/3 of Victorians, when asked, would you personally be at risk at 10 kilometres over the limit, 2/3 of respondents said they personally wouldn't be at risk. That's what we call the I'm a good driver syndrome. It's dangerous for others, it's dangerous for other people, but it's not dangerous for me. I can tell you at the TAC, we received 73 new clients yesterday. And to be a client of the TAC, this is not a tap on the bumper bar in a supermarket. You have been injured enough, often catastrophically injured, to be in a trauma hospital. And the very last thing we need now as Victorians is more people putting pressure on trauma hospitals, giving the fabulous and amazing and heroic work that our nurses and our surgeons and our doctors are doing on behalf of all of us. So we're releasing this report today to get Victorians speaking about road safety. It always turns on fundamentals: slow down, take your time, be courteous. As Jerome said, it's a fabulous day, in particular for regional Victorians, so with that greater movement around the state, it's pretty unforgiving if you make a mistake at 100 kilometres an hour on a regional road, let alone 110 kilometres an hour on a road without a wire rope barrier. So put simply, if you are lucky, you will be caught at that speed. If you are unlucky, you will be catastrophically injured and your family will have to live with those consequences, or potentially even worse, your family will be organising an online funeral next week. Thank you.
Minister, what's your thoughts about a plan for getting out of lockdown? Do you think that should be announced this week? We haven't heard any new details as of today.
The Premier has made very clear that he's working with the Chief Health Officer on the plan, and we're focused on getting vaccination rates up. We know the more vaccinations is the best thing we can do when it comes to combating the Delta variant, and as is being widely repeated, the headwinds of Delta are very much combated by the tailwinds of vaccinations, and that is urging all Victorians to get vaccinated. And the Premier, with the Chief Health Officer, with the leading ministers, are working day in, day out on what can be announced in the future.
But can you give Victorians any indication? Obviously, New South Wales announced their roadmap yesterday. We all have our eye on September the 23rd. Is that a date that we can work towards, or is there any movement on that?
Well, I mean, the Premier, I saw myself, said yesterday, following what New South Wales has done, that he's working very hard, trying to get all the right data, all the right information, and will make very important, considered decisions at the right time. But it's very important to get these decisions right. It can cost lives, and we want to make sure that Victorians do get vaccinated and that we come out safely. And that's what the Premier and lead ministers are focused on.
Is there an understanding in government, though, that the limbo, having no dates, is what causes a lot of angst in the community? Do you understand that there is that feeling out there, not having any hope or anything to look forward to at the moment?
Look, there is hope with the vaccination rates going the way they're going, and all Victorians should be very proud of that. All members of the government are talking with our communities, whether it be online, talking to our schools, whether it be online or via email. We know Victorians are doing, really hard yards, but we must be vigilant and get all the health data, get all the health advice, and make the decisions appropriate. And it's wonderful for regional Victoria that have, got these, these new freedoms that have come in today, and we'll be exercising them. But we're also being very vigilant too. And I know as Public Transport Minister that, this virus, wearing a mask on public transport is the best thing you can do. But it's also why we're having to beef up, our public transport authorised officers at a lot of those gateway stations to regional Victoria. Very concerning to hear reports that people think it's valid to get on a metropolitan train to travel to regional Victoria for a vaccination. That is not one of the permitted reasons, and if you are doing that, you can expect, a very significant fine, and we're out in force to protect those freedoms that have occurred in regional Victoria and to be vigilant right across our public transport system, supporting the work of Victoria Police that they're doing this weekend on our major roads and arterials to really ensure that everyone continues to do the right thing, because that's our way forward.
Has the government got a plan to get kids back to school, and what day will that be announced?
The Deputy Premier, Minister for both Education and the Mental Health, is working with the school communities. He's working very closely with Cabinet colleagues, and he will have further to say on this in due course.
For how long? How many? Is it days, weeks?
Well, the Deputy Premier and Education Minister has been very clear again, and he's highlighted himself this week in the Parliament as a father, I think, of 3 children, that he knows full well the importance of getting kids back to the classroom, but it's got to be done in a safe manner and done where it can be a proper learning environment for the students, and that is what he's working towards.
What about regional Victorian kids? It's only Prep to 2s and Year 12s at the moment. Is there any movement on that, and when could that be expected?
That advice comes from a range of factors, and making it a targeted return to the school classroom is so very important when it comes to density levels, the learning environment as well. So we know mums and dads, parents, home learning has not been easy, but we have to get the settings right, take all the available information and advice, and I know both the Deputy Premier's Education Minister and also the Minister for Mental Health is working very diligently, talking to the key stakeholders, both from education, independent schools, Catholic schools and government schools, to make sure the settings are in place going forward.
Is there any plans to increase we've got 39,000 vaccinations at State Hub yesterday, which is an amazing result. There is new Pfizer doses expected to come next week. Is there a chance to get 100,000 doses a day at state-run hubs? Have there been staff hired to just significantly increase that capacity?
Look, it's outstanding to see the overwhelming success of the state-run vaccination hubs. And I know even in my own electorate where, Jerome highlighted the Royal Showgrounds where I went for my vaccinations. And, so we're urging everyone, let's continue that momentum we have. Let's continue to drive up the vaccination rates. I know through National Cabinet, the Commonwealth, the state government, the Premier talking to the Prime Minister, we're doing everything we can to make sure, as it's been repeatedly said, that the best vaccination, the best jab is the one that's in your arm, whether it is AstraZeneca, whether it is Pfizer. If you can get it, go do it, book in now, it's your best line of defence.
Is there a reason with 300 plus cases again today that the Premier or Health Minister isn't here for the press conference?
No, I was always planned to be here, and just to really reinforce the importance for the public transport system. In particular, Victorians have been doing the right thing. We've been leading as a jurisdiction in the country on mask wearing on public transport, one of the first jurisdictions in the world, and we've kept it strong. And we've now rolled out the QR codes, but we also wanted to give a timely reminder to Victorians to do the right thing, particularly with the road toll being above at this stage what it was last year. Every one of those 156 deaths was preventable, and we need to be vigilant, and Victorians should be vigilant too, that you may not have been doing as much driving lately, and you also need to ensure that you drive safely, mindful, are fully aware of your surrounds, and let's all sort of take it easy out on the roads.
Ben, have you read the New South Wales roadmap?
I have not read the New South Wales roadmap, no.
I might ask Jerome the same thing then. Jerome, have you seen the roadmap out from New South Wales?
Mark, I've been rather focused on what's happening here in Victoria rather than go update myself.
The reason I ask is just because, as somebody who's involved in the contact tracing efforts,
sure,
I'm curious as to what those level of restrictions at 70% double dosed, say if they were applied in Victoria, might mean to you and your team.
Yeah, look, I mean, obviously the epidemiology, the projection of where we're going with the pandemic here in Victoria is a matter for the Chief Health Officer and our public health team. As you know, that's not the remit that I have. But I'll be very clear, Mark. Our focus at the moment here is what else can we do to contain the widespread community transmission we're seeing in the north and west. The work that the public health team are doing right now is working out what direction are we on. Are we on a projection that looks a lot like New South Wales? And is that the case numbers we need to prepare for going forward? Or can we still, as Victorians, get this contained at a far lower trajectory, which gives us far more options over the weeks ahead? And I think that's the work that's going on now. There's a huge amount of modelling going forward to try and understand which of those trajectories we can be on and what difference those different measures will make around all the good questions around return to schools and return to economic activity. So that's the focus the team has right now. I think in terms of timing, we're all frustrated. We'd all like to know when we can do things again, when we can return to normal practices, when we can go out of Melbourne again, and when all those other things become possible. Our focus as a team over the last few weeks has been around how can we contain the pandemic as much as possible. That's what's allowed us to release regional Victoria as of midnight last night to see, and we'll watch the development over the coming days really carefully. If we're seeing the virus continue to be contained and we don't see huge spot fires in regional Victoria, that will give us confidence and open up more options going forward. And that's all the work we need to do over the days ahead.
You say that we'll have more options if we keep our cases lower.
Sure.
We are in a better situation to Sydney when it comes to case numbers and hospitalisations.
Yep.
Is it fair for Victorians to expect that they will receive the same level of restrictions easing once we get to 70% double dosed if, like you say, we are able to keep the case numbers below where Sydney is?
Yeah, look, again, I'm not going to try and verbal the Chief Health Officer or anticipate where his direction is going to be. But what I can say is the lower we can collectively contain these cases and the more we can contain them to the clusters and the areas we currently have under wraps, the more options we will all have over the days and weeks ahead. And that is really finely balanced. We've seen very challenging case numbers in the last 4 or 5 days. We are desperately focused to try and find a way of holding those case numbers down. There are some things that give us confidence in terms of that we can clearly see the pattern and where it's spreading. We know where the nature of the transmission is taking place, and we're seeing literally 40,000, 50,000 people a day coming forward to get tested, giving us a very strong indication of where the virus is at. It's now how all of that work and all the work we're doing on the ground converts over the coming days and weeks as to where we go over the months ahead.
You've outlined two trajectories there, either one that is similar to New South Wales or one where we flatten. Some would say we're already on the trajectory of New South Wales. Would you agree with that, or are you leaning towards one more than the other?
No, I wouldn't agree with that yet. I think it is still in our hands collectively, not only as a health team, but also as a Victorian community around where this goes next. Absolutely, if we drop our heads and say, well, that's it, it's all too hard now, just let go, then we'll be in an even more dramatic situation than our neighbours are in New South Wales. We have it within us. If we grip this up, stick with those directions, stick with those difficult things we're all being asked to do, and hold that together for a relatively short period of time. That is a very challenging thing to do. We've seen evidence of slippage on some of those things. It'll be as to how we all behave over the days and weeks ahead as to where this pandemic goes through to the end of the year.
Can you tell us then what's happening out in the north? We had community leaders yesterday that were very complimentary of the work that you've done, but something is still going on out there. They want more vaccine. What do we need to do to help that community and to get it more under control there?
Look, and I think the community the community across Victoria, but particularly those community leaders in our northern suburbs, in our western suburbs, have been amazing over the last 6 weeks in terms of the passion right at the very beginning of the outbreak when we were dealing with some of those really large complex schools, and their continued work day after day since then. There's two things we need in north and west, and two things we need across the rest of Melbourne. One is absolutely the more vaccine we can get, the quicker we can vaccinate people and the quicker we can dampen down the pandemic. That is the single most important thing that will make a difference, both here and in other parts of the city and the state. The second thing we need is for all of us, particularly the communities in the north and west, to do all they can to stick within the existing directions. Because the fewer people that spread from household to household, the fewer people that spread it incidentally, accidentally, when they're at the supermarket or whether they're going down their local shopping strip, all of that will magnify in terms of the impact over the days and weeks ahead.
Is it still household to household? That's predominantly what's driving.
There's a significant amount of household to household transmission, and look, for all the reasons we understand, and for all the reasons that all of us have human empathy for, that we're all tired of this. We all want to look out for our friends and for our families and for our loved ones, but we've seen time and time again how dangerous that is. The things that make a difference are minimising all of that contact as much as possible and getting tested early. The sooner you get tested, the sooner we can support you medically, the sooner we can make sure you get the support you need and the welfare you need, and the sooner we can look after all the other families and loved ones that are in your circle.
There's a suggestion out in the north and west that when specific food stores become tier 1 sites and they're shut down, that then families travel to other food stores because they can't get what they need from, say, the major supermarkets. Is that a problem out there, that once these places become tier 1, people venture out of their 5K to get what they need?
Look, obviously, when we have a particular site, a particular store that's a tier 1 site, they will usually go through a very straightforward protocol. We'll download all that QR code information, which is so important for us to understand who's been impacted. And I mentioned, Cassar Sweets is a good example of that. The more we know about the customer base, the quicker we can support them to see if they've been impacted. We usually go through a deep cleaning protocol, and then the store will open up again. We do not close stores for weeks on end. Now, clearly, there are some tier 1 sites where if the staff are positive, that people run into staffing shortages. But again, we work with store owners, with their customers to say, well, these are alternative places you can go to. Of course, it's difficult, and we would always ask people, the reason we ask you to stay within 5Ks, the reason we ask you to restrict your shopping trips to essential items only, is to minimise movement and to minimise the spread, and that's what we have to double down on.
The North and the West have welcomed the idea of more targeted vaccine programs, but there are some councils saying that they would like their workers to maybe get involved. Is there any scope for that to happen? Is that part of your planning at the moment for other healthcare providers to assist the state effort in those targeted areas?
Yeah, look, the constraint right now to vaccine delivery is not the number of people who can hold a needle or a syringe. It's the number of people it's the amount of vaccine we've got to give to people. So we're continuing to expand the workforce that is part of that vaccination effort. That's why we did 39,000 vaccinations yesterday, because more and more people are coming into the state system to deliver those vaccines. But again, the GPs and the pharmacies are crucially important components of this wider national vaccination rollout program. We're delighted to see that over the coming weeks there'll be about 350 more GPs coming onto the Pfizer program here in Victoria. That will provide a significant boost of availability to or access to Pfizer in those communities. And similarly, over the course of this month, the Commonwealth will be rolling out 700 pharmacists, again, primarily within the Melbourne and the inner urban areas, again, to provide access to Moderna. So those are all really good things. But the more vaccine we can get, the more of those essential workers we can vaccinate.
The Minister mentioned getting on a train to get a vaccine in a regional area is not a reason. Can you just clarify where can people in Metro Melbourne go to get a vaccine? We've heard anecdotally that some people are travelling to the regions almost as an excuse. So what's the rule? Are you seeing that as a pattern emerging? How many people are sort of breaking that rule? What's the problem?
Sure, look, so let's be really clear. If you live in Metro Melbourne, you can go to any vaccination centre within Metro Melbourne. You can go to your GP, you can go to another GP if they'll take you, you can go to one of our state clinics within the metro area. You cannot go to regional Victoria for a vaccination, you cannot go to regional Victoria for a test. It's a really clear rule. Now, we have heard reports, anecdotal reports and some evidence reports of people from Melbourne going to regional Victoria to go and get vaccinated. And we've seen, of course, there's some indications that the positive case in Mildura may have been gone to get a vaccination whilst visiting family at the same time. That is not the behaviour we want to see. So really clear, simple arrangements. We don't think it's been widespread, but again, there is sufficient vaccine available in Melbourne. There is sufficient vaccine available in regional communities, and we allocate vaccine based on the population that is in need of vaccination. So we do not want to see people crossing all over the state to get that done.
Is that a change of the rule or a new rule?
It's a tightening of the rule. So look, it's always been a very clear understanding that we of course encourage people to get vaccinated, and you have to leave your house. One of the 5 reasons to leave your house is to get vaccinated, has always been over the last few weeks to get vaccinated. We've never wanted to see people going huge lengths to go and get vaccinated 3 hours away from their home. There's an element of common sense around that. The directions that went up last night, now that we've eased restrictions in regional Victoria, makes it very clear you cannot, as a Melburnian, leave Victoria to get vaccinated.
How widespread is this issue? Obviously, venturing to regional Victoria is a bit of a stretch, but are we seeing people just going from suburb to suburb?
Not really. And look, I think, again, there's a bit of common sense around this. We want people to get vaccinated, full stop. We allocate vaccine to all of our 50-odd, 50-plus, 55-plus state clinics, and we make best endeavours to reflect that according to the need that we see in that community based on age profile, vaccine uptake and ultimately availability that we get from the Commonwealth. Of course, we see people going, will try their luck. If they can't get vaccinated at the nearest centre, they'll try the vaccine centre a little bit further down the road. That's not a problem. Again, we'd ask people to be broadly sensible about that. We don't want to see people from Bayside rushing to Broadmeadows to go and get vaccinated. And on balance, I don't think that's happening in any great volume.
Are you still dealing with vaccine hesitancy, as we did last year? There were a lot of groups reluctant to come forward. Are you finding that it's just supply that's the issue now?
At the moment, it's a supply. So every single drop of vaccine that we put into the system gets taken up really quickly. And we're seeing that universally across the state. So we're seeing really healthy take-up levels within regional Victoria. We've got some absolute challenges with younger populations who've only recently become eligible for vaccine. But as the community leaders demonstrated yesterday, they're desperate to get vaccinated in all of our communities. And the more vaccine we can get out there, the more that people are taking it up.
On the man that passed away in his 70s, are you able to tell us his vaccination status and if he was in hospital?
Yeah, he wasn't vaccinated.
And was he in hospital or at home?
He died in hospital.
At home?
Yeah.
On Pfizer, we understand about 290,000 doses arrived today as part of that UK swap. Do you know what portion Victoria is getting of that 290,000?
I'm not sure of the 290,000. So of the overall 4 million Pfizer doses that were negotiated by the Commonwealth from the UK, 1 million doses are coming into Victoria. Over the course of the programme, over 5 weeks, I believe, there is a 60-40 split. 600,000 of those doses are going to Victorian GPs to help more of those GPs get onto the Pfizer programme, which is excellent news. And around 400,000 of those doses will come into the state system. There's a combination there of first doses and second doses. So I think our initial allocation is around 150, 160,000 doses of that first tranche is coming into the Vic system. And those appointments are already being made available in the system. So We put a load of Pfizer appointments into the system yesterday. There are more Pfizer appointments going into the system today, and we'll continue to do that as more vaccine becomes available.
Send them to Melbourne's northwest, where we're seeing significant cases occur. Will it be
absolutely. So, look, over half of all the state vaccines are allocated to our north and western areas. So, our Western Public Health Unit and Northeast Public Health Unit, 52% of all the state vaccines go to those areas. One, because there's the greatest need in terms of the current state of the pandemic, but also because we have a younger age cohort there. We have lower levels of vaccination at the moment, so we want to see those additional vaccines go in there. It's also a target area. We've asked the Commonwealth to prioritise putting the activating pharmacies in the north and west particularly to speed up the access to Moderna and to get more GPs activated in that area, and they're responding in kind.
Jerome, do you think compliance would be improved if the government provided some more clarity and certainty to people about when they could expect freedoms? Do you think that people would stop visiting family and friends if they knew that in 3 weeks they could meet someone at a park or at a playground?
Look, Mitch, I think, absolutely. I think we'd all like to know what the future holds. We'd all like to know how much longer we need to hold on to this and how we can measure out our efforts over the weeks ahead. But equally, I don't think our public health team and our chief health officer can provide, just empty promises or vague aspirations that aren't substantiated in robust modelling and analysis and a clear understanding of where we're currently at. That work is being done right now, and I think just for a public health team or for people who are running the COVID response to hold out false hope isn't going to help us either.
So when do you realistically think we might see a roadmap?
So look, that work is happening at this point in time. I have no data, so when that roadmap is going to be released.
Have you been consulted about the roadmap? Are you part of those conversations?
I'm part of wider conversations around as our modellers go through, both our internal modelling teams and external experts like the Burnett, as they go through the different scenarios, as we watch the numbers evolve every day, and as we try to understand what trajectory we're on, and also what the impact of the different measures are. Absolutely, there's a wide team of us that are involved in those conversations, but the modelling team is sitting off to the side and working through those, weighing up those really difficult choices and options, and that will continue over the days ahead.
You mentioned what trajectory we're on. I mean, the case numbers are frightening. We haven't seen numbers climb into the 300s since August in our deadly second wave last year.
Yeah.
Jerome, where to from here? I mean, can you give Victorians any hope, any indication? We're watching the case numbers. We're not sure where to go from here. So.
Yeah, I think we're all, none of us like these case numbers, and it's an exceptionally challenging set of numbers, and a really, it's a really precarious position that we're in. I think what I would say is that the positives we can draw out of the situation we're in today says we know where the community transmission is happening. We can see where it is, and it's been very concentrated there for the last couple of weeks. We're not seeing significant seeding out into other parts of Melbourne at this time. There's a few stray arrows around, but we haven't as yet seen significant activation in other parts of Melbourne at this time. And there's a huge amount of work being done by our local public health teams to keep it in that position. And we're not seeing at this point significant spreading into regional Victoria. So the more we can contain it into the places where it's at, the more we can support those who are currently living with COVID and minimise their ability to pass it on to others, the more we can keep those numbers down. But it does take a community. It takes all of us to do that. We cannot do that alone by issuing more directions. We cannot do it individually by chasing every single case. It needs everybody to be aware that we have significant levels of COVID in Melbourne that we haven't seen for over a year, and we all need to be responsible and mindful of that as we go about our day-to-day business and to minimise that movement.
Sorry,
Mark.
I was just going to say, we're seeing case numbers continue to increase, but testing numbers are actually dropping slowly. They were in the 50s, now we're low 40s again. What does that say to you?
Oh, look, I mean, case numbers going up is always worrying and is always a cause for concern, and I think I've touched on that, Mark. I think the testing numbers have actually been pretty consistent over the last 5-6 weeks. We've done over 1.5 million tests now since early August. We've been averaging, high 40s, 1,000 tests every single day, and they've held up in the areas where they've needed to hold up. So, look, clearly, if we're standing here in 2 weeks and the testing numbers are at 30,000, then I'd be concerned. But I think at this point in time, we're seeing good evidence that people are coming out, getting tested, and getting their results quickly, and we'll want to keep that up.
You've previously said that one of the issues you're encountering in the north and west is COVID fatigue, people exhausted and frustrated with restrictions and making small breaches. Given it seems like this lockdown is going to go on for a bit longer, how are you going to combat that?
So in terms of, and I think the question was really how do we keep people from breaching, given how long this is going on? Was that the nature of the question? I couldn't quite hear it.
Yes, more or less, but given we don't have a roadmap and we don't have any plan for exiting the lockdown and people don't have anything to look forward to, how do we get people to comply with the rules when they're just over it? Yeah.
Look, I think that's firstly, the overwhelming majority of Melburnians and Victorians are complying with the directions and are doing their very best. And I think everything we see around us, everything we see in the data, everything you see with what the enforcement and compliance teams tells us is the vast majority of people are doing their very best to live within the very difficult and very challenging set of rules. And absolutely, the longer this goes on, the harder that gets. But if I look at the over 1,000 home visits we make every single day for people who are isolating, again, compliance levels are through the roof. The 98, 99% of people are exactly where they need to be doing the right thing. If we look at the enforcement and compliance work we do with people visiting the businesses that are open, again, really high rates of compliance with their COVID-safe plans. So the vast majority of people, I think, are trying to do the right thing. And we all just need to hold on to that. Now, there's a lot of additional resources and support going into particularly into our northern and western suburbs, where we're working with local councils, we're working with all arms of government and all of our health services and community health providers and primary health providers to support people who are living with COVID, to continue that education program and to have that dialogue with all members of the community around this is what safe looks like, and to provide that ultimately that welfare support that enables people to isolate safely. And that is detailed, low-level, low-key individual work that we have to keep doing, and we'll keep doing that. And the response from the communities we're working with is exceptionally positive. But look, everyone's finding this tough. No one likes to see the numbers we're seeing every day. Everyone's finding it hard to do this. But equally, we all know that the more we focus on this, the more we drive at these numbers, and every single infection we can prevent today prevents another 10 infections 2 or 3 weeks down the road.
Jerome, it might be a question for the Minister, but in terms of there's a story in the newspapers today about essentially Muay Thai fighting being approved for a Sunday. I think there were roughly 8 professional bouts. Is that the distinction? Can you just run us through why something like that is approved while community sport is still obviously offline?
Yeah, I'll just wait for them to go past. Just take a moment of peace and calm. Deep breath. Right, so I should have time to prepare an answer now, right? So I'm not sure either the Minister or are booked in for the viewing of the Muay Thai boxing event. But look, my understanding is it's a professional event which is being filmed only under strict controls. There is my understanding is there's no crowd or any other people associated with this event. Essentially, it's a professional sporting event under very tight controls. I'm not sure if the Minister wants to add to that.
I had another question for Jerome before you swap over. Yeah, just on essential workers. So we've had an outbreak now, a V-line worker, a call centre and a construction worker. I just want to know what's the plan from here to how to manage to ensure that services aren't disrupted, essential work isn't disrupted, and how we can better protect this workforce.
I'm sure the Minister or Nick may want to speak to V-line, but in terms of essential workers, and this again a conversation we've been having over the last week, really, I think in these conferences. Essential workers are keeping everything moving. They're providing those critical functions, whether it's keeping our supermarkets full of food, keeping our supermarkets open, keeping our trains running, keeping our roads safe, all those things that are essential things that need to happen. And in doing that, essential workers are, of course, a real vulnerability for transmission. That's why it's so important that anybody who is out there with those authorised worker permits complies absolutely with those COVID-safe principles, because they are the biggest risk we've now got for spread of the virus, not only household to household, but across our entire community. So, we do a lot of work with employers for those essential services to make sure that their COVID-safe plans are in a good place. And again, it's around, and again, what we see on the whole is really good compliance by some essential workers, but it's a day-to-day thing. You can't just say, well, I was good last week and I can slack it off this week. It's an absolute, it's both an obligation that you've got, it's a duty you've got as an essential worker, and it's a privilege that you can carry on and do the job you do, which is so important, while so many of the rest of us have to work from home.
Is there anything being done across the board, widespread to police, whether it be regular COVID tests, vaccination rates, anything that the government can do across all industries?
We're obviously working with all those essential services industries. There are significant numbers of essential workers that have been prioritised for vaccination, going all the way back to February. If you go back to our original work programme around the frontline workers, quarantine workers, people in health services, aged care, all those essential public services have all been prioritised for vaccination right the way back to the beginning of the vaccination programme. That work, of course, continues. And look, and we continue to do what we can to support those employers and those essential workers to do the difficult jobs they do.
Jerome, can we get you to clarify something you said earlier regarding 52% of the vaccination supply going to the north and west? Is that from the state system or is that the whole thing?
No, that's for the state system. So, we allocate vaccines across our 55+ state clinics, and we have essentially a formula that we deploy, which ensures that we prioritise those places where we have the most significant levels of COVID transmission, obviously at this point the north and west, where we see the most significant gap between lower levels of take-up of vaccination, usually because of the age profile of the people living there, and we prioritise it that way. So 52% of our vaccines are allocated to our Western Public Health Unit and our North East Public Health Unit, servicing our northern and western suburbs.
Can you just clarify where the V-Line train driver went to in Gippsland?
So he was. So the V-Line staff member resides in Gippsland, as all V-Line drivers do. And I'm reaching back into the memory banks. V-Line drivers do operate across the V-Line network. Although my understanding is this individual primarily worked on the Trigon services.
Do we know where in Gippsland he lives?
No, well, that's not necessary to be shared. It's an individual who lives in Gippsland. Again, he's complied with all the protocols as we understand it that V-Line have put in place. Got himself tested really early on, which is a big step forward, and we'll wait to see what exposures that might have been at V-Line. Again, can I just thank the entire V-Line team? It'll be a challenging day and weekend as a significant number of V-Line staff are furloughed, and as we work through their primary close contacts and their testing status. And my thanks to all the customers of V-Line for bearing with them.
Do you know how the V-Line, or do you have any theories on how the V-Line employee contracted the virus?
Yeah, well, we haven't got a complete lock on this yet, but the early indications are there's been some exposure to individuals who are living in high-risk communities, so we think it's a community acquisition through that route.
Right, and would that be in the north or the west? Sorry,
it's in the western suburbs.
in the western suburbs.
Was the train driver vaccinated, the V-Line worker vaccinated?
I don't know that status in front of me at the moment.
Do you know why the V-Line driver was in the western suburbs, given he lives in Gippsland?
So there are some family movements in that area.
Can I just ask the Minister one more question?
Me?
The Minister.
Yep. Thank you.
Minister, I know this doesn't really fall into your portfolio, but do you see a time where vaccinations are mandatory for everyone that works at hospitals, not just doctors and nurses, but cleaners and orderlies as well?
This is an important question about the mandating of vaccinations, and I know in my portfolio, we've been surveying both V-Line, Metro, Yarra, our staff, and we're very pleased that we're sort of around the 70% mark around the public transport network. And, I thank all the public transport staff. But when it does come to the mandation of vaccinations, that is a matter that will continue to be worked through. And there's a lot of intelligence that supports, every bit of encouragement that we can do to get people, particularly at high-risk settings and on the front line, vaccinated. And that's what we still have to take the advice on.
Sorry, can you tell us how many approximately V-Line staff have been stood down because of the exposure?
Yeah, so this one individual did enter the staff room at Southern Cross Station, and that has impacted up to 100 staff at this stage is our forecast, and we think that is around the right number, and we're working through all of any disruptions throughout today. As I said this morning, we've got 36 coaches, 5 are already out in use supporting commuters out on the regional network, and working with the executive team at V-Line over this weekend. We're trying to minimise disruptions as much as possible come Monday, but urging all commuters to please continue to look at the PTV app, look at the disruptions, and also make sure you do the QR code, always wear a mask on public transport, and also make sure you use your Myki card where appropriate as well.
And sorry, just again on the V-Line employee, if he lives in Gippsland and he works on the Traralgon line and in Southern Cross, wouldn't he have been breaching the rules of lockdown to be visiting family in the western suburbs?
No, as Jerome said, he was also at Southern Cross Station, and often regional employees do have living arrangements where they work overnight.
Yep.
For example, all of our V-Line staff today, beginning all the morning services, we've had very limited disruptions today, but a lot of the staff are coming back on in the afternoon that we've had to make arrangements for. So, and he was a trainer driver, so he was always working within the rules. He'd always been wearing his mask. I think he only may have removed his mask during a lunch break within the rules, and that was it.
Joe, sorry, Joe, I know that this may not be preventable, but have you heard about the passing of 2 people in Cockatoo this morning? It sounds like a tree has fallen on their vehicle. I know there's not much they can do, but when you were talking about speed, obviously there's some things that are within a driver's control, but they've still got to be aware of the surroundings.
No, I confess I haven't actually got the... we get all of the police reports, but on that particular one I haven't this morning, no.
When it comes to drivers dying on the roads, that obviously when they're not at fault, what is the TAC's approach to that?
Yeah, so the TAC set up in 1986 is a no-fault scheme, actually. So regardless of fault, if you're involved in a transport accident, you and your family will be supported.